Fighting Blindness Canada's Viewpoint is a virtual education series that brings you the latest in vision research presented by health experts from across Canada. The webinar you're about to watch is a recording. To learn more about the research we fund and upcoming webinars and events, please visit our website at fightingblindness.ca. This Viewpoint webinar is proudly presented by Bayer and supported by Allergan, Biogen, Janssen and Novartis. We'd also like to thank Accessible Media Inc., our national accessibility partner. Everyone here should download the AMI app, which is a fabulous resource. And you can watch excellent programming, including previous Fighting Blindness Canada events. Thank you for watching. We hope you enjoy this webinar and share your thoughts with us in the comment section below.
Sure, so I'm actually going to share my screen here. And I've got a whole bunch of slides here that we will spend a bit of time going through. And I think, Morgan, you'll find that most of the questions I think you'll have for me will be through these slides. So thank you so much to Fighting Blindness Canada for inviting me to speak this evening. Very, very happy to be here. And thank you to everyone who's joined this webinar with us to learn a little bit about glaucoma. This is really a very timely talk for us because right now we are in the middle of World Glaucoma Week. And World Glaucoma Week is a worldwide event where glaucoma specialists and eye care specialists around the world partner with community organizations such as Fighting Blindness Canada here to provide community education and outreach and just raise awareness about glaucoma itself. So up here I've got this wonderful graphic that the World Glaucoma Society has made available to us. And basically the tagline for this year is "The world is bright, save your sight." And I really like this. They really come up with very interesting taglines each year for World Glaucoma Week. So I guess we'll get started with some of these questions that Morgan had asked me to just address this evening. So what is glaucoma and how does it cause vision loss? So I guess the first thing that we need to think about is how do we see? And for you to be able to see, there's a number of things that need to happen. So on the left here, we've got just a little graphic of an eyeball. And so you need your eyeball to be working. And if the eye is working and light is getting into it, then that's going to be able to allow you to have processing happening in the eye itself. And then you need the brain. The brain has to get all of that information and process it and turn it into the images that we see. The eye is connected by a little cable, and so I've just got a little cable that's popped up here joining the eye to the brain. And this cable essentially represents the optic nerve. So the optic nerve is the connection that goes from the eye to the brain. If everything is working just fine, if the eye is working fine, the cable is working fine, and the brain is top-notch, then you're going to get vision. And so here I've just got a nice pretty picture of a forest. Not sure exactly where this forest is. Now in glaucoma, we start to run into a little bit of a problem. And the problem really centers around the eye and the optic nerve, so that cable going from the eye to the brain. In glaucoma, you get issues where the eye pressure begins to cause damage to the optic nerve. And so here our optic nerve is just screaming out a little bit to us. It doesn't like the pressure. And over time, what ends up happening is that the side vision gets affected or damaged or reduced. And what we've just happened here is that nice picture of the forest, the edges of it are kind of dimming out or darkening. And this kind of simulates what can happen for some people with glaucoma. So the second question that was asked is, who is at risk of developing glaucoma? And I think the one of the titles that went out today for this talk, I think, is very prescient, which is that glaucoma does not discriminate. Glaucoma really can affect anyone at all. There are certain things that put people at an increased risk for developing glaucoma. So there's certain things about yourself that really you're not able to change. So for instance, your age. We know glaucoma tends to affect people who are 40 years or older, but there are types of glaucoma that can affect you regardless of the age. If you have a lot of family members who've got glaucoma, that certainly does increase your risk. And certain ethnicities, as we go around the world, various ethnicities have been found to have slightly increased risks of certain types of glaucoma. There are certain things about the eye itself that can put you at risk. So, for instance, the shape of the eye or various rigidity components of it and different aspects of that can increase your chances of getting glaucoma, as well as previous eye injuries. So these are all things that you really can't change about yourself. Now, there are things that you can change, and these are also risk factors, what we describe as essentially treatable risk factors. So probably the most important one is having high eye pressure. And so eye pressure is quite different from blood pressure. Everyone's eyes has a certain amount of pressure in it, and that's just normal. You need it to sort of maintain the structure of the eye. But for some people, if the pressure is a bit too high, that can lead to damage to that optic nerve. There are certain systemic or whole body diseases that can also predispose you to glaucoma in certain ways. So, for instance, diabetes on its own doesn't cause glaucoma, but if, for instance, you have very poorly controlled diabetes, then over time that can lead to a host of different eye problems, which one of them is glaucoma itself. And then finally, long-term use of certain types of steroid medications can also cause the pressure in the eye to go up, and that itself can lead to glaucoma problems as well. So as I was mentioning, these are just risk factors for glaucoma. So some people have some of these, some people have none of these. The more of these you have, the higher the chances of getting glaucoma, but it's not a guarantee in either situation. And that being said, glaucoma can affect all age groups. For instance, there are sometimes babies who are born with glaucoma, and this we call congenital glaucoma. So that just means glaucoma from birth. Thankfully, this is very, very rare. Some children and young adults can also develop glaucoma, and we would call this juvenile glaucoma. And that just means it develops when you're still quite young, as opposed to the more run-of-the-mill glaucoma that I see in my practice day to day, which typically is for slightly older people. There are some eye diseases that can be linked to glaucoma. So that doesn't necessarily mean that they cause glaucoma, but sometimes they go hand in hand. So for instance, certain people who've got types of eye inflammations or eye infections, they can have pressure problems. I mentioned a little bit about diabetes, and similarly, people with high blood pressure or cholesterol problems can also develop eye problems, again, leading to certain types of glaucoma. And in some rare situations, particular medications people are on can predispose them to having eye pressure problems as well. So for instance, certain seizure medications and sometimes some allergy medications. Now, you may have noticed that I've been saying, kind of going back and forth, sometimes saying such and such will predispose you to glaucoma, such and such will predispose you to eye pressure. And I am being reasonably specific about that because sometimes these various things can just lead the pressure in the eye to go up, but that doesn't necessarily mean that you have glaucoma. Again, if we go back to one of the underlying thoughts here is that high eye pressure is a risk for developing glaucoma. And again, the higher the pressure, the higher the likelihood that people would get glaucoma itself. So the next question is, what are the types of glaucoma? And this is an important question because glaucoma is really a broad group of conditions. It's not just a single disease. There are many different types of glaucoma, and some of them are treated very, very differently from others. So up here I've got a couple of pictures. And so these are basically just three-dimensional schematics of eyeballs, just sort of cut out in cross-section. So in the left, we'll begin here and we'll talk about the first type of glaucoma. And so just to understand this, I'll just review a little bit about how eyes work and how eye pressure works. So if we think about the different parts of the eye, we've got the clear cornea in the front, and that's here at the top of the image. And then within the eye, you've got the colored part of the eye, that's called the iris. Sitting behind the iris is the natural lens of the eye. And over time, that lens can become cloudy, and that's what we call cataracts. And you've probably heard about cataracts before. Now, sitting just between the colored part of the eye, the iris, and the lens, is a structure called the ciliary body. The ciliary body, its main job is to make the fluid that moves around in the eye. This is also called the aqueous humor. And the aqueous humor, or the fluid, that's what provides all of the nutrition and support to the structures inside of the eye. So this fluid gets produced behind the iris, or the colored part of the eye. It moves around through the pupil, that's the black part of the eye in the middle, and then it goes into the front part of the eye where it bathes the various structures, and it eventually ends up draining through the drainage system in the eye, which is right in the corner. And as ophthalmologists, we like to give these things specific names, and so we call that the angle of the eye. The reason I mention that is because that's one of the main distinctions that we have for different types of glaucoma. We have what we describe as an open angle glaucoma, which means the drainage system is open and there's nothing blocking it. And that's probably the more common one that we see here in North America. There is also the angle closure glaucoma, or the closed angle glaucoma. And that's represented on the picture on the left, which is very, very similar to the picture on the right, with the main difference being that the colored part of the eye, the iris, is now bowing forward. It's being pushed forward, and it is actually blocking up that drainage system. So in both these situations, you can get elevated eye pressure from different mechanisms. In the open angle glaucoma, the drainage system itself seems to be open, so there's nothing physically blocking it, and yet the eye pressure still goes up. As opposed to the closed angle or angle closure type of glaucoma, in this case, the colored part of the eye, the iris, is physically blocking the drainage system, and it's kind of like plumbing. If you block up the drain, then there's nowhere for the fluid to go, and so the eye pressure goes up. This angle closure glaucoma, it's probably a little bit more common in other parts of the world, particularly in certain parts of Asia, but certainly we see this a fair amount here in North America as well. So these are sort of our two very, very broad categories of glaucoma. And underneath these two categories, there are many, many different subtypes as well. I'm not going to go too much into detail about those. The way that we treat them really does depend on the specific individual. And so sometimes it'll be one set of treatments for one, sometimes a different set for the other. So a question I get asked very frequently in clinic by my patients is, what is normal eye pressure? And this is one of those classic questions that you ask your doctor, and the doctor says, well, it depends. And this really is quite true for eye pressure as well. Now, you probably, if you are seeing someone, an eye care provider for your eyes, you may hear the term intraocular pressure instead. And that just means eye pressure itself. It's just a different way of describing it. And really, everyone is different. In general, we think about an eye pressure measurement between 10 and 21. The units that we use are millimeters of mercury. The units are not really important. It's just the number. And that's what we consider to be average. But really, the term normal, I prefer to say that this is something, or this is a level of pressure in the eye where that particular nerve feels safe. And what that means is that there are some people out there that can have a reasonably high pressure. So let's say the number that they have is 23 or 25. So that's higher than what we consider average based on the numbers I've put up here. But some people can have a number like that and not have any problems for years and years or even their entire lives. On the other hand, there are some people who can have a number that falls within that 10 to 21 range, and yet they still develop glaucoma problems. They still develop damage to those nerves. And so everyone is different. It's not just the specific number. It really is about the individual and that particular person's eyes. So we really do customize things on a person-by-person basis. So the next question here is, what if I have high eye pressure? And I'll put the little asterisk here to say high eye pressure, again, doesn't have to mean that it's just over that 21. It could be just too high for this particular eye. So what if I have high eye pressure? Will I get glaucoma? And do I have to have high eye pressure to get glaucoma? So we'll go through all of these questions for the next couple of slides here. So the first point here is that if eye pressure is too high for a particular nerve, so a particular optic nerve, then damage may occur. And this seems to be a bit of a recurring theme that I'm bringing up this evening. So again, higher pressure means greater chances of damage. It doesn't mean that damage is guaranteed to happen, but the higher the pressure goes, the greater the likelihood that damage will happen. As I mentioned, some people can still develop glaucoma problems or optic nerve problems despite having a reasonably normal or lower eye pressure. This is the so-called normal pressure variant of glaucoma. And all of this is probably due to individual susceptibilities for different optic nerves. So some optic nerves probably just are a little bit more susceptible, be it through a series of genetic conditions or things about the eyes themselves, or possibly other factors for the rest of the body as well. And so every person and every eye can be quite different. So this question here, I think, is probably one of the most important questions for the current week, which is World Glaucoma Week. And the question is, how can I tell if I have glaucoma? Glaucoma, as I've mentioned, comes in various different forms. And if you go through some of the old medical literature, there used to be this very dramatic description of it, which I think is still very apt. And glaucoma was often described as a thief in the night. And what this means is that glaucoma, in many situations, does not have symptoms right at the beginning. People can have glaucoma and really have no idea that it's there. Uh, this is the case for the majority of glaucomas. The good thing about glaucoma, if there is a good thing, is that it tends to be a very slow moving condition. It's typically not something that changes very rapidly. The downside to that is because of the way it affects your side vision first, which is not really part of the vision that we often think about on a day-to-day basis, people may not even notice that there's any problems happening. So people can go years or even decades before they start noticing a problem. So they might start noticing the side vision, the peripheral vision starts getting affected. They might start bumping into objects a little bit more, and they might start even noticing some blurry vision. Unfortunately, if it's getting to this point here where the central vision is being affected, that often means that the glaucoma has gone on quite far. And this is one of the important takeaways from this evening, which is the importance of getting regular eye exams, because glaucoma can be such a silent condition that people may not even know that they have it. Now, that being said, there are slightly more rare types of glaucoma, acute glaucomas that we call them, that can present with very, very dramatic conditions. So these are what we describe as acute or sudden glaucomas. And these are much, much more rare, thankfully. The way that these typically present is that individuals will have pain and redness in the eye, and it often gets worse over hours. So this is not the type of pain and redness that you may have sort of a little bit of irritation here and there going on for weeks or months and months. This is something that happens very, very suddenly and is often associated with seeing halos or rainbows around lights, as well as a really bad headache and frequently nausea. People are often in the emergency room throwing up because the pain and the nausea can be so bad. And this often has a rapid reduction in the central and the side vision. So this is thankfully a much more rare type of glaucoma, but for people who have these types of symptoms where they've got a sudden change, a sudden reduction in vision with significant pain, headache, nausea, and seeing halos around lights, that's the type of thing that people really do need to get looked at right away. So getting back to the message from the World Glaucoma Society, oh, sorry, for World Glaucoma Week, in terms of how do we detect glaucoma, again, the message here is the world is bright, save your sight. For the most common slow-moving glaucomas, the most important thing is getting regular eye exams. And depending on the age, some people probably need to be getting eye exams more frequently. So people over the age of 40, probably just every couple of years is fine. And then as we go up in the decades, you want to be getting those eye exams at least once a year. And if you've got more risk factors, so for instance, a strong family history or certain things about your eyes, then probably you need to be getting checked more frequently than that. All right, so the next big topic we're going to talk about are what are the treatment options? And I think we're going to return to this a little bit at the end of my slides because I know there have been quite a few questions about treatment options. So in general with glaucoma, if you think back to one of the first things I said, is that there are a number of different risk factors or things that predispose people to developing it. There are risk factors that you cannot change, and there are risk factors that you can change. So eye pressure is really the main one that we have any sort of control over. So our goal in glaucoma is generally to bring that eye pressure down. We don't have a way of reversing aging. We can't really change your family history. And at the moment, at least, we can't change your genetics. So these are risk factors that we have no control over, whereas eye pressure is a risk factor that we do have control over. And in general, there are sort of three broad categories of treatment options that we have for lowering eye pressure. So on the left here, I've got a little symbol for an eye drop bottle, and it's got a little eye drop coming out that's got a little healing sign on it. I quite like this, this graphic here. In the middle, I've got sort of a starburst image or graphic, and that really represents laser treatments. And then on the right, I've got a little scalpel, and that represents surgeries. And so these are sort of the three broad categories of treatments that we have. And so let's talk about each of these. So eye drops are one of the most common types of treatments for glaucoma. There's many different types of eye drops out there. These tend to be ongoing treatments. So once you get put on eye drops, it's very, very rare to ever get off of the eye drops unless you have some other treatment. And generally what the eye drops do is bring the eye pressure down. And there's different mechanisms by which these work. Some people have certain conditions in other parts of their body that might limit the types of eye drops that can be used for them. And for some people, they develop some redness or irritation to the eye drops. That typically gets better for many people. But for some people, it can be quite annoying and quite uncomfortable. And they're not able to use eye drops long term. And so sometimes we have to think about other treatment options as well. For the eye drops, people will often start with just a single bottle of drops, and it's often just used once a day. And you know, just the whole idea of getting a drop into the eye can be quite a bit of a challenge for some people, especially if they've got difficulty with their hands, if they've got perhaps some arthritis, it can be difficult to squeeze the bottle itself. So these are all things that need to be discussed with your eye care provider if eye drops are being decided as the first line of treatment for someone with high eye pressure. And then the important thing about eye drops is they only work when they're being used. So if you're not using your eye drops, the eye pressure is not going to be staying down. And in fact, it might be going up again. And those pressures going up and down and up and down, that itself can cause problems for the optic nerve or for that cable that goes from the eye to the brain. So lots and lots of drops, and some people end up being on multiple bottles. Sometimes it can be 2 bottles, sometimes even 3 bottles. And so that's a ton of work. And as doctors, we all know that the more bottles that people end up on, the more difficult it is to put the eye drops in, to remember to put them in, and also, there's obviously a cost associated with all of these medications that can be quite burdensome for a lot of people. So for these reasons, we're often thinking about ways, how can we reduce the total number of drops that people need to use? But unfortunately for some people, they do need to be on quite a few drops to keep their eye pressure down. So we'll talk about the next type of treatment, which is this middle graphic here of this little starburst, so laser treatment. So there are a number of different types of lasers that we use in glaucoma, and these lasers, generally, the goal is going to be either to help open up the drainage system in the eye. If you think about our two general types of glaucoma, we've got the open angle glaucoma and the closed angle glaucoma. There is a type of laser that we use that can help open up that closed angle so that the drainage system is less blocked by the colored part of the eye, the iris. Excuse me. So that is one type of laser that we frequently use. And that's called a laser iridotomy. You may have heard that term from your eye care provider. There is another type of laser that we also use that the main goal for that is simply just to bring the eye pressure down. And that is a type of laser that we use where we direct energy from the laser, a very, very gentle laser, to the drainage system of the eye. That stimulates the drainage system. It kind of wakes it up, gets it moving a little bit more, and it's kind of like unclogging a drain. By doing so, the eye pressure generally comes down. So laser procedures can be very, very helpful for people. Sometimes this can be the first treatment that people with high eye pressure choose. For other people, it can be an adjunct or an add-on treatment later on in the process once they're on maybe 1 or 2 other eye drop medications. For some people, they respond very, very well to these lasers and the pressures come down very nicely. For other people, they don't respond quite as well, and then they may end up needing to be on more eye drops. Depending on the type of laser that you're having, for instance, if it's the one that lowers the eye pressure, sometimes we can even repeat that a few years later if we start to find that the effects of the laser begin to wear off. And so these are all individualized treatment options that we have, specific for the patient and sometimes even specific for a particular patient's eye. And so lastly, under the lowering eye pressure treatment options, I'm going to talk just a little bit about eye surgery for glaucoma. And there are many different types of surgeries. One way that I like to conceptualize this is that there are small, medium, and large glaucoma surgeries. And oftentimes these do involve different types of cuts into the eye to either restore the natural drainage systems that already exist within the eye or to create new types of drainage systems in the eye, all with the goal of trying to lower eye pressure. And as I mentioned, there's many different ways of doing these types of surgeries. Some of them work well for certain types of glaucoma, and others don't work as well for other types of glaucoma. In addition, how bad your glaucoma is can also dictate the type of surgery that your surgeon may choose if you end up needing to have glaucoma surgery. So for instance, someone who's got a very advanced glaucoma who really needs to have their eye pressures as low as possible probably won't be a very good candidate for one of the smaller glaucoma surgeries. They probably will need a much larger glaucoma surgery to get their eye pressure down. And this is, again, very, very case dependent, really depends on the particular individual themselves. And your surgeon will often think about lots of other factors that are going into this in helping decide what is the optimal surgery in those situations where it is needed. All right, so moving on. So we've talked a little bit about the different types of treatment for glaucoma. The next question someone might ask is, I've been treated for glaucoma, possibly for a long time, but my glaucoma is still getting worse. So what is going on here? So again, here's my recurring theme for the evening. Every eye is different. Some eyes need lower eye pressures in order to stop the glaucoma from getting worse. So you may see an eye care provider initially and find your eye pressures at a certain level. They may start you on a certain treatment and the pressure comes down. And they say, okay, that looks good, pressure's better, let's keep monitoring for now. And over time, it may be found that despite the pressure being lower, things continue to progress. And what that is happening there is the body is basically telling us, you know what, we need to get this pressure down even more. And so sometimes when you've had one type of treatment, you may still need more treatment. And this may mean if you've had one eye drop, you may need more eye drops. If you've had eye drops and laser, you may need further laser. If you've had one surgery, sometimes you may even need multiple eye surgeries to keep the eye pressure down. It all depends. Everyone's eyes are different. Some types of glaucoma progress a lot more quickly. Others are much, much slower and don't need multiple treatments. So while we're talking about treatments and different types of eye drops, a question that commonly comes up is, are brand name and generic drops the same? So there's a couple of ways that we can think about this. So the first thing is that in Canada, we've got very, very strict guidelines when it comes to the manufacturing of medication or medical therapeutics, things like eye drops and tablets. So your brand name medications are the ones that were originally developed by a particular pharmaceutical company. And then the generics are ones where after a certain period of time, generic manufacturers are able to recreate the same medication. And in Canada, we have rules where the active part of that medication has to be very, very, very similar between the generic and the brand name medication. So in terms of efficacy, brand and generic eye drops generally are equivalent. Now, that being said, there are some people who may tolerate brand eye drops better for one reason or another. Sometimes the generic medications have different secondary components that go into the eye drop itself, and for some people, those can be a little bit more bothersome. Certainly not for everyone, but for some people. The downside to brand eye drops is that sometimes they can be more expensive. And if individuals don't have third-party insurance or drug coverage, this can become quite a burden to them. And that is why sometimes your doctor may choose to prescribe a generic eye drop instead, which frequently can be a little bit cheaper than the brand medication. But that being said, if you are on just generic medications, you can be confident that the efficacy of that should be very, very similar, if not the same, to brand medications. So another big question, how can I reduce my risk? How can I reduce my risk of getting glaucoma? And so again, coming back to the theme for World Glaucoma Week is regular eye exams. Now, there is some discussion out there about certain lifestyle changes that people can make. And really the message here is a healthy body promotes good health. There's a number of things that someone could consider doing. The thing is, we don't have strong evidence to say that these specifically help people reduce the risk of getting glaucoma, but the way that I think about these, there's certainly no harm to them, and they may help the rest of your body, and that itself may be beneficial in totality. So for example, getting regular exercise, this may help blood flow to different parts of your body. And we know that there are some thoughts that blood flow to the optic nerve, the cable that goes from the eye to the brain, may be compromised for some types of glaucoma. So improving blood flow stands to reason that might be beneficial. Food with certain antioxidants, like our good old green leafy vegetables. We know that these certainly do help other types of eye conditions, and they may be able to reduce certain types of inflammation in the body. Again, there are certain types of glaucoma where there may be a bit of an inflammation component. So having this in your diet certainly is going to help with other things, and perhaps it might help reduce the risk of glaucoma as well. Certainly quitting smoking is one of the most beneficial health changes that anybody can make just in general. Whether or not it reduces the risk of glaucoma is hard to say, but certainly the other benefits it confers to you are indisputable. A couple of things that we do know that we often will advise our patients about is certain, for instance, yoga positions or other bodily positions can, for people who have established glaucoma, maybe increase their risk a little bit. So specifically in yoga positions, if you've got your face pointed down and the rest of your body elevated, we do feel that that probably increases the eye pressure. If it's just for a few seconds, it's probably okay. But if people are sustaining that type of pose for minutes on end, that's probably not the best idea if you have established glaucoma. If you don't have any glaucoma and your yoga instructor feels that it's a good thing for you to do, then in moderation, it's probably okay. The other important thing that we'll always counsel patients on is wearing good eye protection anytime you're doing any sort of activity that may put your eyes at risk of being injured. The reason here is that different types of injuries to the eyes can predispose to particular types of glaucoma. So for instance, if someone gets hit in the eye by a hockey puck or a squash ball, over time that can cause increased pressure in the eye due to damage that the drainage system might sustain, and over time that can lead to glaucoma as well. So there are certain lifestyle things that people can think about that may reduce their risk of glaucoma. All right, so we're moving now into some of the more theoretical questions. So is there any research happening into causes and treatments of glaucoma? So glaucoma research is absolutely ongoing, and it is a bustling field. There is so much glaucoma research happening all over the world at many institutions. And at all levels of the condition. So there's lots of research going on just basic scientific questions, trying to find out some of the underlying mechanisms for how glaucoma happens. We're looking into different ways and different techniques to better diagnose glaucoma, because if we can catch it earlier, that's probably going to be better. Obviously, there's a lot of work going into improving treatment options, be it new types of eye drops or new ways of delivering the eye drops, or even beyond that in terms of different types of surgical treatments and beyond. There's a lot of research going on right now looking into certain surgeries that may be less risky than our traditional surgeries. And of course, there is the ongoing field of regenerative medicine, which is something that is probably still on the horizon, but we are all hopeful that one day may show us a lot of promise in terms of treatment for glaucoma. So what resources exist for people who are interested in glaucoma or who have glaucoma, or even just family members for people who have glaucoma? So I've put up here a number of resources, websites, groups that have a lot of very helpful information about glaucoma. So for instance, the Fighting Blindness Canada website has got a great section on glaucoma. The Glaucoma Research Foundation has a very extensive section as well. Glaucomapatients.org. Now, this is a very nice website that was built by the World Glaucoma Society. And again, this is freely available to people around the world. And it has a lot of very, very helpful information. Some of the images that you saw today on my slides were taken from the Glaucoma Patients website. They're very, very helpful images. The Canadian Glaucoma Society, so this is a group of glaucoma specialists from around Canada. We have a website as well. A lot of the information on the website is really geared towards the glaucoma specialists itself, but there is an information section specifically for patients, and it's got some great information there as well. And then finally, your friendly local ophthalmologist or optometrist certainly can be a good resource for information as well. And you heard earlier on today from the good folks at Allergan Abbvie that they've got that app coming out in the next little while. So that'll be something else to think about. All right, so I think that's pretty much what I had for my prepared slides here. So again, it is World Glaucoma Week. The world is bright, save your sight. Go get your eyes checked if you haven't. And Morgan, I'm just going to stop sharing my screen here.
Perfect. And I will unmute. Thank you so much. That was fantastic, very comprehensive. And we did a little social media poll this week. And the thing that people were most interested in hearing about is treatments for glaucoma. And I thought that was just a really wonderful, fulsome description. Okay, so we're going to get to your questions, audience questions, in just a moment. So a reminder, you can put them in the Q&A box. I see we have a bunch there already. And we can also email me, again, education@fightingblindness.ca. So while you think about your questions, and we'll give Dr. Kanjee just a moment to have a glass of water and take a little break, I'd like to introduce all of you to my colleague, Jamie, who's here to talk a little bit about how you can help us and get involved.
Thank you so much, Morgan. Dr. Kanjee, that was excellent. Thank you so much for the presentation. I'd like to take a few moments tonight to talk with all of you about our monthly giving program. Before I begin, though, I would like to thank all of our monthly donors who are joining us this evening. Thank you for your support. Every day you are making a difference by funding the very best vision research. Thank you. Our monthly donors are such an important part of our Fighting Blindness Canada community. Monthly donations provide reliable and ongoing funding, so future projects and long-term investments in vision research can continue to be possible. If you would like to consider making a tremendous impact by joining us, join our monthly giving program today. For as little as $1 a day or $10 a month, every monthly gift is meaningful and makes a difference. Please consider joining our community of core supporters. You can help create a brighter future for people living with vision loss and their families. If you'd like to become a monthly donor, please visit our website at Fighting Blindness Canada, fightingblindness.ca, or please call Josie at 416-360-4200, extension 262. And of course, fightingblindness.ca, and please reach out to us. Thank you so much for listening and taking the time to join us this evening. Back over to you, Morgan.
Thank you so much, Jamie. Really appreciate it. And I just wanted to clarify, a couple of people have asked in the chat or in the email, some people had difficulty logging on at the beginning, and I just want to let everyone know that this presentation has been recorded and we will have it available for you to watch afterwards, so you can still get all of the information that Dr. Kanjee has provided. So it will be available, and I will send a link out to everyone probably tomorrow in a follow-up email for you to watch that. All right, so are we ready for some questions? I have quite the list here.
Right.
So why don't we start? You talked a little bit about research into glaucoma. So Hidram asked, is there any specific research in stem cells on glaucoma? And if so, is it in clinical trials? Is it still in the lab? What's the status of that?
Yeah, so stem cells, this is a very interesting topic. So essentially stem cells are particular types of cells in our body that have the ability to turn into different types of cells. And so this is something that's been very, very exciting in the world of medicine, probably for the last 20, 30 years. Stem cell therapy, we have active stem cell therapy for certain types of blood diseases in medicine. For the eyes in particular, there are a number of different types of stem cell therapies that are in research. Some of them are actually being used right now. So certain cornea diseases, so cornea is the window to the front part of the eye. There are stem cells that can be used to treat that in very specific scenarios. There is some research going on into stem cell therapy for a different type of eye disease called macular degeneration, which is age-related wear and tear. With respect to glaucoma in particular, there are a number of laboratories around the world that are looking into stem cell therapy. It's still very early on right now, so I don't think we're quite at the stage of getting into clinical trials. There's different ways that people are trying to approach this. The idea being to try and regenerate some of those cells that get damaged within that cable that goes from the eye to the brain, the optic nerve. If we can regenerate the cells that get damaged by glaucoma, perhaps that can restore vision to people who've lost it. I'm certainly hopeful that within my lifetime we will see that, but it is, I think, still a ways away.
So you spoke also about medications or particular drops in medications and how we have different sort of regulations maybe here versus other countries. So Rita had a question about a drug called Rocklatan. So she said Rocklatan is available in the United States but not here in Canada, and she's wondering if you could talk about why it's not available here in Canada and is it likely to be approved, and sort of what your opinion is of this drug. She said her grandson is 16 years old and she says she knows it's not recommended for children, but it has been recommended that he use it.
All right, so I'll speak just sort of in general about the medications. So Rocklatan is notarsidil. It's one of these newer medications that has sort of made its way into the glaucoma space in the last few years. There's a few of these sort of newer players on the block. All of these have gone through many, many years of research and trials in order to demonstrate that they are able to lower eye pressure and do so safely. So we're certainly hopeful that we will get access to this medication in Canada. It comes in various different forms. The Rocklatan version is sort of two medications squished into one, and then there's Rhopressa, which is just the medication on its own. I suspect Rhopressa will be available in Canada reasonably soon, probably within the next year or so, if not already available in certain parts of Canada. It really depends on the way the company who manufactures it moves the medication through the regulatory process. It's quite interesting because often in Canada we are fortunate to have access to certain surgical devices a lot earlier than other parts of the world, just by virtue of some of the way that things move here and the fact that we have a lot of people very keenly involved in the development and use of these surgical devices. Sometimes with the eye drops, we can actually be the reverse, where it can take a little bit longer to get for the drops to get here. And it's all just about the regulatory process. So it is out there. It will eventually make its way here. And when it is here, it's something that will probably be used in certain situations. I'm not going to comment specifically on a particular patient's eye condition or their treatment. I can't comment on a patient if I haven't actually seen them myself.
Of course, that's one of the challenges of this sort of format.
Yes.
People, you can't give them medical advice without actually needing them. So our last webinar we were talking about AMD and we were talking about vitamins a lot. And so Sharon had a question about glaucoma. She said, are there any vitamins that can help with glaucoma?
So we don't know for sure that any of them help. Probably none of them really hurt. If you're on medications for your macular degeneration, so age-related wear and tear, we know that there are certain specific combinations of vitamins that do help slow that down. No, we don't think that those necessarily help glaucoma itself. There was some excitement a number of years ago for the medication or the compound ginkgo biloba, that perhaps might increase blood flow to the optic nerve, and perhaps that would be of benefit as well. None of the studies have really demonstrated that conclusively, so we don't know for sure. We don't routinely recommend it. If your general doctor says it's safe for you to be on that for with regards to the rest of your general well-being, it may not hurt. But again, this is something that you want to speak to your various eye doctors about.
Absolutely. So this is a good question. It's something I've wondered about as well. We're talking a lot about eye pressure. So Angela had a question, and she said she'd like to know if there's any particular exercises that are not advised for people who have glaucoma or even other eye conditions. For example, workouts or yoga inversions, which involve, the head being lower than the heart at certain times. Is there any effect on eye pressure with these types of exercises?
Yeah, so I guess that comes back to one of the points that I'd made in the presentation, and just to review that, there is certainly good evidence that for certain types of exercises like yoga, where you've got your face down and the rest of your body really quite high up, that can increase the eye pressure. And if it's again just for a few moments, it's probably not the end of the world. For people who've got more established glaucoma, we certainly do discourage that type of yoga positioning. You're certainly welcome to do all of the rest of the types of yogas, but those particular positions we'd probably discourage. In terms of other things, it gets a little bit more difficult to say, okay, well, if you do this thing or you do that thing, is that going to increase your eye pressure? We know that certain activities day to day, so just any sort of straining, coughing, that's probably bumping up the pressure for a couple of microseconds here and there. And those tiny little fluctuations probably are okay, and the eye is able to handle that. It's really more sustained things that we'd be more worried about.
Thank you for that clarification, for sure. So we have another question here, and again, this one might be a little too clinical, but let's see here. So Gail said that she has stable low pressure glaucoma and has some damage to her left eye optic nerve. So it has been recommended to her that she have a trabeculectomy at the same time as a cataract is being removed. So her reading of literature and her research indicates that this procedure would be done to relieve high pressure, but hers is low and stable with the use of drops. So she's just asking, is there reasons that she should consider having this procedure done, even though her pressure is stable?
Right. So I'll be able to sort of just talk sort of generally about this question. Again, I can't comment on a specific patient's eye condition or their treatment options. If those questions really that should be directed at the individual's surgeon or their other various doctors. But in general, the low pressure variant of glaucoma, this is a situation where the optic nerve is still seeing damage despite the pressure not being particularly high. We know that even in that situation, bringing the pressure down even lower can still help. It can still help reduce the risk of the glaucoma getting worse. One of the things that I hope I mentioned this evening and that I'll reiterate is that the pressure is not the be-all and end-all of glaucoma. It really is the main thing that we look at and that one of the main things that we monitor. But in some situations, you can have a seemingly well-controlled pressure. It seems like it's in a good number, and yet some of the other testing that we do, so looking at the side vision or scans of the optic nerve or other measurements, those might start to see or demonstrate changes. And so that may be what could be going on here, that the surgeon is looking at other metrics and saying, things do seem as though they're changing, and perhaps we should be considering additional treatment at the time of surgery to try bring these pressures down.
Okay. So let's see. So Brigitte had a question. She said, what is the life expectancy of surgically installed trapdoors at a trabeculectomy surgery? Can this operation be redone? And what are the symptoms of a failing trapdoor?
Okay, so trabeculectomy, I like the description trapdoor. It's one that one of my mentors used a lot when they were describing the glaucoma surgery. And it kind of is that. We make a little flap in the eye that helps to slowly release fluid into a little blister that sits above the eye and is hidden beneath the eyelid. And that helps to keep the pressure down and regulate things. In terms of how long these surgeries last, everyone's different. I seem to be saying that a lot this evening, but unfortunately it is quite true. So for some people, it can last many, many, many years. And it can work perfectly well for years or even decades. For other people, the surgery starts to heal down on its own a little bit too quickly, and then that trapdoor basically closes up and no longer allows the fluid to escape. And in those situations, the surgery might need to be redone, or sometimes a secondary type of surgery that's a different type of surgery altogether, where it's no longer just the trapdoor, but more of an implant, sometimes needs to be done. In terms of symptoms, the way people would know can be a little bit tough for people to know themselves. If it happens very, very early after the surgery, sometimes people will actually notice a feeling of pressure in the eye. But if it's months or years later, often people won't really know unless they're getting their eyes checked. Because if it's just a little bit of pressure going up, people aren't going to be able to feel that.
So lots of reasons to keep going to your
Yes,
optometrist.
absolutely.
Okay, so Karen asks, does a small optic nerve increase the chance for glaucoma?
So that's a fascinating question. Does optic nerve size increase the risk of glaucoma? And what we know is that both small optic nerves and very, very large optic nerves probably do have certain risks of glaucoma in slightly different ways. One of the challenges with a very small optic nerve is it can be difficult to examine it and really say, okay, is this a little bit different today as compared to where it was 2 years ago, or is it about the same? And similarly, with a very, very large optic nerve, everything is very, very spread out. So you might say, oh, well, that part of the nerve over there, it looks very similar. Maybe it looks a little bit thin, but was it always thin? And so when you have these sort of extremes of size, there probably are some increased risks. Some people do wonder about sort of the channel that the optic nerve travels through and whether the size of the channel matters. Probably more important than the specific size of the channel is the overall strength of the channel. And that's something that's a bit more difficult to measure. We've got some newer devices or newer machines coming out these days that give us a sense of the strength of that channel. But if that channel is a bit too weak or flimsy, then there's not enough support for the optic nerve or for that cable. And then you can get damage to the various fibers within the optic nerve.
It's very interesting. So I also had another question here. You were just talking about the trap door, and I'm not sure if this is the same, but Dominic has asked, I said they have a shunt in their eye to drain the fluid. It was implanted 4 years ago. Is this the same, is this the same as the trap door? How long will it last? And are there any sort of new technologies in the field?
Okay, so the shunt, so what I'm guessing this individual is asking about is a slightly different type of surgery that's similar to the trapdoor, but instead of using the natural tissues within the eye to help create a new drainage system, we instead implant a very small tube into the eye that helps to drain the fluid instead. There's many different reasons why a surgeon may choose to use the tube as opposed to the trapdoor. It depends on the particular individual, the particular eye. Sometimes we start with one and then move to the other one. And again, very similar to the trapdoor, the lifespan or the length with which this tube works varies from person to person. For some people, it can be many, many years working really, really well, keeping those pressures down. For other people, because of excessive healing or scarring around it, or other eye conditions that are not adequately treated, those can cause those tubes to not quite last as long as we'd like them to. In terms of other types of surgeries, there's tons of new surgeries that have been developed over the last 15, 20 years or so that are being used with increasing frequency around the world. And we're developing a lot more information and understanding about these newer surgeries in terms of who they can be used for, when they can be used, and whether or not they're safer or at least less risky than some of our more traditional surgeries. So it's certainly a very exciting time for patients that there's a lot more options out there.
And now Tony asks, how is glaucoma diagnosed in people who have normal eye pressure?
Yeah, so normal eye pressure, you can still get glaucoma because pressure is just one of the risk factors. There are a number of other things that we'll look at. So we'll look at the pressure itself. Sometimes your doctor may ask you to come in and have pressures measured over the course of an entire day so we can see how the pressure goes up and down. And we know that pressure fluctuations are a normal part of the eyes. For some people with a seemingly normal pressure, it may actually be quite high at the end of the day, and we just don't know that because you don't happen to be in clinic at that time. In addition to the pressure measurements, we'll look at the side vision. So that's the test where you sit in a little bowl and you press a button and you see flashing lights, and everyone hates it and complains to me all day about it. But it is a very important thing that we need to get done because that measures the side vision. So your ability to see off into the periphery. And so people who have damage to that in a very specific pattern, that can be a tip off that there is some glaucoma despite a more normal pressure. And then finally, examinations of the nerve itself when we look inside the eye, either through just looking at the nerve or taking measurements with different machines, that can help us diagnose the glaucoma as well.
Another question, is it possible for people to test their eye pressure at home, or does it have to be done in a clinic?
So up until quite recently, there weren't really any reliable, easy to use home-based eye pressure measurement systems. There is one that has come onto the market in the last couple of years. There are some caveats to it. So it is a good tool, and there are some places in the world that are using it quite a bit. Each device is certainly not cheap, and so if people want to go out and buy one of theirs themselves, it's going to run you a fair amount. The way that it measures the eye pressure is quite different from the way that ophthalmologists typically measure it in the office, so the numbers are not necessarily interchangeable. But that being said, you can sometimes get some very interesting or useful information from that. Again, thinking about the way pressures go up and down throughout the day, sometimes that type of thing can be helpful. The only problem is it's not available everywhere.
So we have a lot of questions here about things that could increase your risk. So for instance, Pat is asking, does increased laptop or screen use increase your risk of glaucoma? And there's another one who's said they have sleep apnea. Are they at higher risk for glaucoma?
So laptop screen time does not directly increase your risk. Only thing is if you spend too much time and you forget to put your eye drops in, then that'll be no good. In terms of sleep apnea, so sleep apnea is one of these very interesting conditions where the more we study sleep apnea, the more we realize that it does have quite a few different effects on many different parts of the body. So people who have sleep apnea where they're sleeping at night and then they just stop breathing for a few moments, and sometimes the person next to them has to kind of nudge them and say, hey, wake up, you got to start breathing again. We know that, for instance, it does have an effect on heart health. And the more we look at it, the more we realize that there probably is a link to glaucoma, but it's probably not straightforward. It's not just, oh, if you've got sleep apnea, you're going to get glaucoma. It's probably more, if you have glaucoma and sleep apnea at the same time, there's going to be a way that that's going to affect other parts of your body and possibly the blood supply to your optic nerve that could potentially worsen things. Now, we don't know for sure whether or not treating sleep apnea with, for instance, a CPAP machine that helps people breathe or maintain their airway while they're sleeping, whether that's going to reduce the impacts that might exist with glaucoma, but I'd say it stands to reason that it probably makes sense. So someone who's got sleep apnea and they're not currently being treated, go talk to your doctor and see if you can get yourself treated for it.
So we had another question here. There's a couple of people who've mentioned that they have both glaucoma and age-related macular degeneration. And so Mindy is asking, can glaucoma be secondary to the retinal injections that you would get as a treatment for AMD?
So macular degeneration, so this is an age-related wear and tear to the back of the eye, so the retina or the film in the camera. And for people, typically once you get into your 70s or 80s, that's when it's most common to find it. You get part of that retina that kind of gets damaged and doesn't work quite so well. And then for some people, they develop what we call the wet type of macular degeneration, where it's not just wear and tear, it's actually bleeding and swelling inside the eye. And for those people, we now have these incredible treatments, again, in the last 15, 20 years, these types of injections that people use in the eye that really take away that swelling and restore a huge amount of vision. It's pretty incredible compared to what the types of treatments used to be many years ago. What we have been finding in the last number of years is that people who get repeated injections into the eye, probably there is a slight increased risk for eye pressure problems. Now, we're not sure if this is for everyone, and I'm going to guess probably not everyone. I would have to guess that it's the people who may have already had a susceptibility because we have many people getting these injections every single day, and I'm not routinely being sent people by my retinal colleagues saying, I've been injecting this person for months or years and their pressure is now going up. It's not a common thing that at least I'm seeing, and many of my colleagues would have a similar message. So for some people it can be a risk, and that's one of the reasons why the retina doctors do check the eye pressure as well when they're getting those injections done.
So speaking of the other eye conditions as well, so Mira had a question and she says, does cataract procedures help to reduce eye pressure?
So the short answer is yes. The long answer is sort of. So again, some types of glaucoma respond quite nicely to cataract surgery. So cataract surgery is where the lens inside the eye, which helps to focus the light, becomes cloudy, and that causes vision to go down. And so in those situations, we take that cloudy lens out and we put a thin plastic lens that goes in and that helps to restore the vision. So for some people who have a situation where their drainage system inside the eye, that angle that we spoke about, is a little bit more on the narrow side, we feel that taking out that bulky lens and putting in the thin plastic lens kind of helps to open it up a bit, and sometimes that brings the pressure down a bit. As a standalone procedure for glaucoma itself, probably not going to be enough for most people. But again, there's some more modern technologies that we can sometimes combine at the time of cataract surgery to help really augment that pressure lowering effect that it can sometimes have.
How about floaters and flashers? Pauline would like to know, do they have any connection to glaucoma?
So not a simple connection. Floaters are very, very common. Most people in the world have them. If you start suddenly seeing tons and tons of new floaters or tons of flashing lights that don't go away, that is a sign that probably you need to get your eyes checked pretty soon, like within the next few days. That can be a sign of a retinal tear or a retinal detachment in the worst case scenario. More commonly, it's just a change in the jelly at the back of the eye, which is a very common thing. Everyone gets that at some point. Just some people notice it and some people don't. So just having floaters on their own, that does not increase your risk of glaucoma.
How about, we have a few questions about dry eye. Are dry eyes associated with glaucoma?
So not associated directly in that if you've got dry eyes, you're going to get glaucoma, but more just as we get a bit older, dry eyes become much more common. I practice and live here in Manitoba. Manitoba's in the prairies. We've got an incredibly dry climate here. Winters last like 25 months a year. And so we've got the furnace going all the time, and that really dries out the air in the house as well. And so that's going to lead to more eye irritation and dryness. And then unfortunately for people who've got glaucoma who are on eye drops, often the eye drops themselves, even though they're helping the glaucoma, can make eye irritation a little bit worse. So many of my patients actually end up on their regular glaucoma medications, and then we've got them on artificial tears to help with some of the symptoms that they develop.
Okay, there's still so many questions and we're running low on time. Let's see, we'll do a couple more and then we will wrap up for the evening. So Mindy had a question here. So she said, for the treatments that you described earlier, the goal of these treatments seemed to be to maintain vision. Are there any treatments that would help improve vision or regain lost vision?
So one of the things with glaucoma is if you get nerve damage and that affects the side vision, at least for the time being, unfortunately, nerve damage is not something that we can really reverse. If you have reductions in vision for other reasons, so for instance, you're developing a cataract and so that lens becomes cloudy, that is a temporary thing because that's really just the clarity of the eye has been disrupted. And so we can take out that cloudy lens and put a plastic lens in that restores the clarity. But if the damage is from glaucoma itself, or some other eye disease that affects various nerves in the eye or the retina, such as macular degeneration, unfortunately, generally that type of damage is not entirely reversible.
All right, let's see here. One more question. So, and then I'm sorry if we didn't get to your questions, myself or our health information officer will take a look and we will try to get back to you with some information. So this is another interesting one thinking about, pressure. Wendy asks, what is the effect of air travel on glaucoma?
So air travel itself, probably not a big deal. The time that we would be a little bit cautious about air travel is more if individuals have had certain other types of recent eye surgery, so specifically types of retina surgeries where a type of gas has to be injected into the eye to help the surgery work. Then as you go up in the air, the pressure changes, the gas starts to change, and that can cause significant damage to the blood vessels in the eye and actual actually loss of vision. It's not a common thing, fortunately, because people are generally warned about it. Air travel and glaucoma, again, the main thing that I would be worried about is people going off to a different country for vacation and forgetting to take their eye drops with them, and then not taking their eye drops. But air travel itself, I don't see a problem with it.
Unfortunately, right now, there's not a lot of that happening anyway.
That's
No
true.
vacations to forget about our eye drops. Well, thank you so much, Dr. Kanjee. I really appreciate you coming and such excellent explanations for all of these questions. We really put you in the hot seat with rapid fire tonight.
Well, thank you so much for the invitation tonight.